So when looking at pharmacy's role in the healthcare system, it's a very central point of the healthcare delivery system. More than 90% of people live within 5 miles of a community pharmacy. This makes it possible for the majority of residents to locate and utilize any pharmacy resources. Additionally, individuals typically visit their community pharmacist 12 more times than their primary care provider. These are medical providers that many people have relationships and trust in because they are in contact with them so frequently. Because of this, pharmacies can play a vital role in vaccinating individuals. If we look at the information on vaccinefinder.org, we see that in the Western New York area, there are a wide range of pharmacies: Rite Aid, Walgreens, CVS, Walmart, Wegmans, and other local pharmacies that in many instances offer more than one type of vaccine. The pharmacies can play a vital role in equitably vaccinating the community. Here are two pharmacies in different parts of the Western New York region and their vaccine distribution, something that can easily be found by zip code at vaccinefinder.org. Next slide, please. So here shows the challenges that pharmacies have when it comes to vaccine distribution. The pharmacies first have to predict the vaccine demand so that they can order the proper number of vaccines. This is important because they want to ensure that none are wasted, as New York State has the use it or lose it policy. There is also the issue with the storage of the vaccine. For example, the Pfizer vaccine needs to be stored in an ultra cold freezer, which pharmacies may not have access to and can be expensive to install. Since much of the population lives within 5 miles of a pharmacy, it is important to remove apprehension of getting vaccinated so that residents will feel comfortable with reaching out and receiving the vaccine from pharmacies that they have access to. While the vaccine is being administered, there are other considerations to take into account. A trained pharmacist will have to administer the vaccine, so the pharmacy needs to have enough staff to support this. They also need to have the proper setup and protocol in place to ensure social distancing practices while the vaccine is being administered. Finally, the pharmacy needs to have the capacity to ensure that they are able to accurately and effectively record vaccinations and have an adequate surveillance system. They also need to have a system in place that will ensure that people get the second dose of the vaccine if they are receiving either the Moderna or Pfizer vaccine.
We have proposed several solutions to these problems. For distribution of vaccine in retail stores, we suggested that there should be a central pooling and storage of vaccines for all pharmacies based on the population data and demand for vaccines per area. So if there's more demand, there would be obviously more storage in a certain area to increase access. Another solution is for storage, that area-specific common storage units could store vaccines for all pharmacies in the area to ensure that vaccines are properly stored and used only when they are required. Ensuring people reach the pharmacy. Another solution is that we should help people get free or reduced transportation resources to get to pharmacies. Walgreens has partnered with Uber to offer free transportation to its vaccine sites in socially vulnerable communities. We recommend this to deploy in Western New York as well. And we should also remove apprehensions and educate people about where their nearest location is and the benefits of the vaccine and how to get it. There's also administration, where we'll have volunteers who are in the pre-health field and have pharmacists assist with the administration of the vaccine. And we should also have enough distance between people and limit the amount of people in a store taking the vaccine at a specific time to prevent the spread of the virus. Managing records is through having a record of all the people who signed in, what dose they received, their name, age, and where they live. This would be kept confidential, but would allow pharmacies and the network of pharmacies to know about the population they are serving. Also for this, we should encourage people to get vaccinated and share on their social media their experiences so that people will say that they're more positive experience for the vaccine rather than negative experiences. And also people in the pre-health field, such as nurses and doctors, could share their success stories in the media as well and on social media. And retail pharmacy stores should definitely take initiative to educate people about where they can get the vaccine, the benefits of vaccines to their customers. And another group that we really encourage people to talk about is the educational initiatives in public and private schools, so that just more people are aware of how they can get vaccines through retail pharmacies and the benefits of it for themselves and their community.
Possibly the most important tool in encouraging people to prioritize getting the vaccine is educating them on the science behind it. There is an abundance of misinformation spreading regarding the vaccines, especially on social media. So to combat this, one tactic is to use governmental funds to promote posts promoting the science and facts about the vaccine. These posts would be geared towards at-risk communities that are historically less likely to take vaccines. This tactic can very easily appear disingenuous, so it must be done using fact-based claims only with sources clearly listed. These days, there is apprehension towards the media. This is why it is important these facts about the vaccine are distributed by doctors and scientists and not mainly media outlets. Doctors and scientists can visit schools, workplaces, and town meetings to discuss the truthful effects of the vaccine and answer any questions the public may have. Again, this would be geared towards more apprehensive demographics. The Ad Council and COVID Collaborative are leading a massive communications effort to educate the American public and build confidence around the COVID-19 vaccine that communities can take part in. As well, the Department of Human Health and Services, the HHS, COVID-19 Public Education Campaign is a national initiative to increase public confidence in and uptake of COVID-19 vaccines through a nationwide network of fact-based public health messaging and transparency. They also offer grants for this initiative. Mobile vaccine clinics are a great asset for rural areas. For rural areas, the largest obstacle to overcome is transportation to a vaccine clinic. Pharmacies are more few and far between in rural areas, and many people cannot afford to take time off work or time away from home to travel long distances for the vaccine. While we can encourage employers to offer a day off for vaccinations, that doesn't fix the problem altogether. One possible solution to this problem would be those mobile vaccine clinics where the public can make their appointment and the truck can come to their home or multiple convenient neutral locations in one area, such as the local school. Internet access and internet capabilities can also be an obstacle for rural areas and elder demographics. Internet service can be particularly spotty in rural areas, and attempting to schedule a vaccine appointment online can be confusing for someone not as familiar with the internet. So to combat this issue, we can set up a hotline for scheduling vaccine appointments and answering questions. This provides a fast and convenient way for people to easily schedule appointments and avoid barriers in their way. It also ties into the education initiative and easing any apprehension regarding the vaccine by providing an easy place for people to ask their questions.
We would like to summarize all of our recommendations here, and we are recommending that there should be a common distribution and storage centers for vaccine for all the pharmacies, which will ensure that the distribution is efficient and the storage is efficient and lesser number of vaccines get wasted. We're also recommending that we remove vaccine apprehensions among people through social media, through education, and through meetings and webinars via doctor and scientists, and especially in the younger generation who feel that they do not require the vaccination as they are young. We should educate themselves what are the implications of not getting the vaccine. Thirdly, the pharmacies should tie up with cab services to provide low-cost transport or even free transport to people who cannot afford to reach the pharmacies on their own. Fourth, mobile van clinics should be made available to rural areas and to people who can't go to the pharmacies, such as disabled or elderly who cannot reach to the pharmacy on their own. So mobile van clinics would ensure that everybody has the accessibility to the vaccines. And lastly, the pharmacies should send timely reminders to the people who had got their first shot so that they are prompt and reach the pharmacies to schedule and get their second shot of vaccine.